doctor working as associate professor in the Department of Rasashastra and Bhaishya Kalpana at All India Institute of Ayurveda, New Delhi. He completed his PhD from IPGT and RA, Jamnagar. Sir has imparted his services in various fields such as Research Officer in CCRAS from 2006 to 2007, and he nominated as co-opted member Ayurvedic Pharmacopoeia Committee, Department of Ayush, Government of India during 2010, and as Associate Editor of Ayu, the quarterly peer-reviewed International Journal of Ayurveda, and worked as coordinator of WHO Collaborating Center for Traditional Medicine in between 2013 to 2016. He is an expert member of Ayush Research Portal, Ministry of Ayush, New Delhi, and also as coordinator National Pharmacovigilance Program for ASU and H drugs from 2017 onwards. He received CCRA's Young Scientist Award in 2017. Sir, having more than 15 years of PG teaching, recognized PG and PhD guide and principal investigator in various projects. He have more than 120 papers published in different peer-reviewed journals and more than 65 presentations at different events. With great respect, I invite Dr. Ghalib to take over the session.
Sir.
Yeah, thank you so much for saying a few words upon me. So, respected Shankaramrita Puriji, Dean Amrita School of Ayurveda, Dr. Ramji, Research Director, Amrita School of Ayurveda, Dr. Ramesh NV from the same school, expert speakers, Dr. Vishnu, Dr. Devipriya Soman, and Dr. Devisri Damodaranji, Dr. Prajesh, the coordinator of this Peripheral Pharmacovigilance Center at Amrita School of Ayurveda, galaxy of senior professionals, learned scholars, and other stakeholders. Namaskar, and at the outset, thank you so much for inviting me. At the outset, I would like to make this colorful festival build a stronger than ever bond in between all of us. So with this, I hope I am audible clearly and my slides are visible.
Yes, sir.
Yeah. So I have been asked to put a few words.
Sir, can you? Sir, excuse me, sir. Sir, your voice is breaking. Can you switch off the video, sir? Then it will fine.
Okay. Right. Yeah.
Yes, sir.
I have been asked to views on reporting of toxicity due to Ayurveda medicines, the ground reality. So quickly, I will place a few points in front of you, focusing on the increasing demands of traditional medicines and concerns being raised on these days, and how the pharmacovigilance system for Ayush it has been initiated, and what exactly is the reporting culture and the reality in terms of various challenges that are being noticed at the pharmacovigilance program. So the traditional system of medicine in Indian scenario, it is popularly recognized as Ayush. So this is well known, and no one has any doubts regarding their contributions to the global healthcare. The significant contributions, they are well acknowledged at multiple platforms across the globe. So the demand for traditional practices, it has increased multiple times in recent times, particularly during and even after the COVID times. So this demand is even more, it is witnessed. So at present, so we are witnessing a highly receptive environment where the value of Ayush systems in healthcare is widely recognized, and the Ministry of Ayush has also well recognized this demand and it is utilizing every opportunity to showcase the Ayush potential. As well known, Ayush, it utilizes the natural resources in disease management, but unfortunately, the consumers, they believe that natural as safe. They believe that the remedies that are coming from the natural origin, the remedies that are coming from the green source, they are harmless, and they carry no risk. So this belief is existing in the scenario. So though the traditional products, they have medicinal values and are beneficial for human health, so it is important to remember that natural doesn't necessarily mean safe. So thus, there is a need to develop safety efficacy data that can bring scientificity to the Ayush practices. So considering this need, so developing mechanisms that can monitor the safety, developing mechanisms that can monitor the practices, it becomes imperative. So this is what reflected in one of the WHO document. They says that, okay, so the traditional practices are lacking in certain areas, are difficulties that are being faced by traditional practices before they are globalizing. So this is one important area. So developing mechanisms that can monitor safety and practices, it is very much essential. And the same thing, it was even mentioned by our Honorable Prime Minister. So we can see what he focused upon almost a decade back. So he expressed that the Ayush potential for global healthcare needs are to be tapped. This is okay. So he mentioned in 2014 that World Ayurveda Congress, which was held in New Delhi, and in 2022, in the same occasion, while addressing the World Ayurveda Congress in 2022, he called the professional cohorts to engage in generating evidence-based databases. So this is very much crucial, and even the in the same series, definitely I can say that. So the situation review that has been published by Southeast Asian Regional Office of WHO, so they have emphasized on pharmacovigilance, and so they have recommended that appropriate evaluation methods are highly essential for traditional practices. And they have even mentioned in that document that individual countries, they must develop mechanisms to meet that specific need. So this is mentioned in this specific document. And in that direction, so during the initial days of new millennium, it's about 2000 to 2004. So WHO, so they have released a series of documents highlighting the importance of pharmacovigilance in the medical field. And in 2006, if at all, categorically, if at all, we are looking towards the traditional practices and pharmacovigilance for traditional practices, you suppose. So the landmark events, they have been organized in 2006. So the first one is organized in JN Jawaharlal Nehru Medical College, the pharmacology department, which is located in Aligarh Muslim University. So they have organized one, and on the same year, so another professional vigilant group, they in Mumbai, they have and these two events, they have recommended having a vigilant systems, pharmacovigilance systems for Ayush practices also. So this was followed by the designation of IPGTRA, now it is known as ITRA, at Jamnagar as the nodal center for the pharmacovigilance program in 2007. And this program was revived in 2017 with certain added features by the Ministry of Ayush. I'm sure that these developments, they have been possibly mentioned by the earlier speakers. And this is what the hierarchy that we are following in this existing system. So it is a 3-tier mechanism with 19 in peripheral and 5 intermediate centers, which is well established, and that attempts are being made. They have been made to at least establish one center in each state and union territory. And the basic mandates, they have been already mentioned by Dr. Pajesh and other speakers. So the ultimate office to about the system. So that is the basic motto of this pharmacovigilance program. And besides that, inculcating the reporting culture. Okay, so these two are the main objectives of this program. based upon the reports that are being received, so the databases can be generated and further depending upon those system-wise databases. So recommendations for ascertaining clinical safety also can be made. So this is what being planned at this moment, okay, so in this program, and it is being followed since last 5 to 6 years. To meet the first objective, so this is what I mentioned, that generating awareness and inculcating the reporting culture is the important one. And to meet this specific objective, a series of orientation programs that are being carried out across the country by all those designated peripheral pharmacovigilance centers, basically. And I said that, okay, so this program, it is revived in 2017. So since its revival in 2017, so the program, it has organized more than 1,100 such orientation programs, training programs, awareness programs. So they have been organized across the country, across those by those 99 peripheral centers, and all such events. So you can see that the graph. So what the reality otherwise, okay, so in real world, okay, so what the peripheral centers they are doing. So they attempted to at least sensitize more than 90,000 professionals across the country. So this is one achievement that the pharmacovigilance program is initiated, and so it is taking up. So the program which is being done at this moment, okay, so where all the learned scholars, they are gathered there, okay, so under the umbrella of this peripheral pharmacovigilance center of Amrita Ayurveda. So this is also one kind of such initiation. In Sorry for that. So it seems, okay, so when it is being transferred to this, okay, so the color is, I couldn't able to see the graph here clearly, but I would like to say that, okay, so this is one data, so which is being received, okay, so since 2017, the program, it has received more than 1,700 plus individual case safety reports. And so when we are the reports are serious, none of these reports they required hospitalization, or none of these individual case safety reports are fatal in nature, so no fatality was noticed. And though there are no fatal incidents, though there are no fatal reactions that have been noticed, we have to realize that traditional products also can pose some sort of adversity, and as so must that, okay, so these traditional practices also can create, so that's why such kind of formulate such kind of Ayush products. So they supervision of so they are not the products that can be consumed, that can be purchased over the counter and that can be consumed. It's not like that. So no one should feel that. So these are the green sources. These are coming from the green sources. These are the natural formulations. That's why. So there is no possibility of adverse drug reactions. They shouldn't feel that. So they should understand that these are the medicines. They are only supposed to be used under the supervision of a qualified Ayush physician. So this message is supposed to be percolated to the grassroots levels of the end users. So besides, while analyzing whatever it may be the individual case safety report that is being received by the intermediary centers or national centers, of course, okay, so Naranja's algorithm, so they are being followed. Besides that, Naranjo's algorithm attempts are being made even to evaluate the most possible reason for the suspected adverse drug reaction. I'm trying to say that whether the suspected adverse drug reaction is because of the fault of the physician, or it is because of the fault of the patient, or whether it is because of the drug as a whole, or because of which reason, because of which, okay, so reason, so such kind of adversity is manifested. Okay, so this is what we are trying to evaluate. And of course, while doing these interactions, whenever we are conducting so these awareness programs and orientation programs, and while our interactions with multiple stakeholders at different platforms, so it has been revealed that so there are many misconceptions even today they are prevailing in this scenario, and majority of the consumers and even professionals, I would like to reiterate that not the layman, not the okay, not even the highly professional communities also, so they feel that traditional medicine is safe to be used. So that misconception even it is there in today's scenario. So it has been noticed that many end users, many patients, they use these formulations concomitantly with prescription drugs, many times without informing to their practicing physicians. Okay, so these are the practices which always bring a bad reputation to the system as a whole. So that's okay. So that is also one important area. So we need to consider. So they feel that these end users, they feel that the traditional formulation they don't have a expiry date. So they feel that okay, so once it is prescribed, so they can be used for long. So there are no dose limitations. As much as I want, I can consume it. So such kind of misconceptions they are prevailing in the society. So that's why there is a huge need to educate the communities at large, and this is what being focused in multiple occasions in various orientation programs by the uh, basically by the coordinators of these peripheral centers and intermediate centers. So when we look into so these areas, of course, those misperceptions, so they are there in the communities. And at the same time, so whenever a pharmacovigilance system is there, pharmacovigilance system for traditional practices is considered, you suppose. So there are many other areas that also need to be considered when we are executing, when we are kind of systems. In comparison to the conventional system of medicine, so when we see the traditional systems of medicine, suppose, so their therapeutic approaches are so they are unique. The health maintenance and disease management in the traditional practices, in traditional approaches, so they deal with what I can say, they deal with empirical practices, including medication with natural elements or processed elements, focusing on overall wellness with varied methodologies and philosophies. So the therapeutic modalities of diseases, they are based on, you know it very well, that Prakriti, Sara, Samhana, and all those things will come. They are based upon subtypes and stages and the severity of the diseases, and the medicines are prescribed on a customized approach or a personalized manner after a thorough examination of all those factors that are very much essential to be evaluated. So understanding of human individuality through assessment of each individual constitution, and it forms the traditional systems constitution. So considering such customized therapeutic practices, it becomes very difficult to implement pharmacovigilance system in traditional systems of medicines. MD staff focus on such kind of practical difficulties. So we're trying to come up and these 1,000 plus so individual case safety reports. Okay, so that have been received at our end. Okay, so they are giving us new leads to analyze the scenario. So this is drug regulation is also so one specific factor that is being experienced at the pharmacovigilance program. So some part of the medicines are available as non-prescription medicines across the country, so that everyone knows it. So some herbs, so they may be supplemented as nutraceuticals or food supplements or dietary supplements, or okay, so many times as a botanicals also, they are available in the market. But not as medicines. So they're not being sold or they're not being dispensed as medicines. So there are subtleties in the legal differentiation in between the food supplements, in between the nutraceuticals and the dietary supplements and the herbal medicines. So this is one biggest challenge. This is one biggest, I mean, when we come to the real world, if suppose of implementing such kind of programs, so these are the issues that creeps into the systems. So that is one biggest thing. So at many to add to this one, so advertisements is also one important area. So at many times, advertisers they advertise that herbal medicine originated from the natural herbal medicines that are that belongs to green therapy uh, or okay no, they won't have any sort of toxic material, so they won't create any sort of adverse effects and people can take it in the long term. Okay, so this such kind of such kind of advertisements very frequently we used to come across. So all such kind of issues, all such kind of instances, they will mislead the end users. There is no doubt about that. So it may lead to adverse events by misusing. So when the consumers believe such kind of advertisements, when the consumers purchase the products over the counter, when the end user use it as a dietary supplement or a food supplement without any supervision of a qualified physician, suppose, so they may lead to adverse events, and that's why. So it becomes very challenging when pharmacovigilance system is considered. So reporting of adverse drug reactions in such kind of instances, if at all somebody consider it as a dietary supplement, if somebody is considered it as a botanical, you suppose, okay, so in such kind of instances, ADRs, okay, so it becomes very difficult to be reported. So the adverse reactions that may develop in such cases may not enter into the databases of actual pharmacovigilance systems. So this is one important real world practical difficulty. So that the system is experiencing. As I said earlier, consumers they often believe that the traditional products are natural and they are safe to be consumed. So this perception, so it is there in the in the grassroots levels. And herb drug interaction is one important area so which need to be considered. So when there is a increasing use of dietary supplements, nutraceuticals, and such supplements which are available over the counter for self medication, so many a times the sufferers, so the patients, so they will purchase them. How they are going to be purchased is a different domain to be discussed. But okay, so as they are available over the counter, so they will purchase them directly from the outlets, and they will consume in conjunction with the prescription medicines. So it is essential to understand the consequences of such combined use and monitor whether any adverse effects are arising with such a practice of concomitant use or not. So this is very much essential. And this is definitely an important and unfortunately is an underestimated area in therapeutics, particularly when traditional systems are considered. So unfortunately, as I said, unfortunately, evidences on such kind of herb drug interactions and what exactly happens on their concomitant use with the prescribed drugs is meager. So very limited amount of information is available. And herb drug interaction is an important aspect to be considered in pharmacovigilance systems. So in that direction also, the pharmacovigilance systems, they should consider, and attempts are being considered, attempts are being done to look into this specific domain by the program. And this is another important area is the skilled manpower. So despite of global concerns against the medication safety. There is lack of awareness and knowledge the pharmacovigilance programs by the professional communities. So knowledge of pharmacovigilance is and support by ADR reporting, suspected ADR reporting among the healthcare professionals. It has been noticed that it is very less, and at countries and in a few countries it has been said that it is lacking. So there is no reporting. Okay, so such kind of such kind of reports, they are available. So healthcare professionals, they are crucial, and they can play a significant role in the pharmacovigilance system. All such professionals, so they need to have a considerable knowledge and expertise so that they can successfully contribute in the pharmacovigilance system. So early detection, early management, and reporting of safety issues, they hold highest importance in the healthcare system. So thus, healthcare professionals should be trained at regular intervals to improve skills related to the concepts of pharmacovigilance system. So this current attempt, what the Amrita Institute of Ayurveda is doing, is also one of such attempt to initiate, to at least impart some basic knowledge related to the pharmacovigilance systems, and to encourage the young think tanks to at least know that, to understand that, yes, okay, so traditional practices also can create some sort of adversity, and our responsibility is to report it. So that is what the initiation that is being done by the current event. And okay, so considering so all these aspects, all these challenges, in the middle of all these challenges that I was mentioning, the pharmacovigilance program is trying to generate awareness among the stakeholders and to inform that no medicine is safe in all circumstances to all people that they are consuming. So proper use only can lead to effectiveness. This is very aptly it is quoted in that decade document of 2014 to 2023 by World Health Organization. So they have mentioned about proper use. They have mentioned that all the medicines are supposed to be consumed under the supervision in an appropriate way. So this is categorically mentioned in this document. And I'm sure, because I was recollecting one of the words from Charaka Samhita, they have aptly mentioned, Ayurveda has taken that pride in mentioning that prayoga shamayat vyadhim yo anyamanyam udirayet. So which infers that Shuddha approach to treatment that pacifies the diseases without causing any new manifestations is categorically, so it reflects about the keen vigilant approach of traditional healers while managing any sort of disease. So to sum up the brief address that I was trying to put in front of you, I would like to say that, and even I would like to reinforce that the traditional practices are to be consumed under the supervision of qualified and registered physicians by following all those specified instructions. So the traditional practices, traditional formulations are not the over-the-counter formulations. They are supposed to be considered as medicines, and they are not nutraceuticals, they are not food supplements, they are not the botanicals. So they are the medicines, they are the drugs, they are the they are supposed to be always to be considered as medicines. So though lesser in severity, traditional medicines may also manifest adverse drug reactions. We cannot say that these are coming from the green sources, that's why so they are safe. No, so it's not like that. So these practices also can create adverse drug reactions, and all such adversities are to be reported to the pharmacovigilance system, so that at least, okay, so we can understand that at which part of the country which kind of signals are being generated. So what kind of individual case safety reports are occurring at times. Okay, so they may be crucial in the healthcare systems also. So that's why, so it is very much essential to be reported. So the contribution and sincere participation of each and every stakeholder, it becomes immense and pivotal in this program. Please join hands together in this noble endeavor. So your active participation can definitely bring a positive change in our surroundings. So and further, it will help in refining all Ayush clinical practices. Yes. So we cannot feel that, okay, so no one can change the scenario. So you definitely can change the scenario, and your sincere involvement can help in opening windows for framing future policies, and further will help in mainstreaming of Ayush systems. Does it is in your hands? Definitely, I can say that. Okay, so the young think tanks, okay, so the PG and PhD scholars, whomsoever they are hearing, okay, so this brief address, I request them, please come forward and join hands together in this global cause. Thank you so much for the invitation. Thanks for the patient hearing, and please be vigilant and contribute to the system. And dear organizers of Amrita Institute, the institute which is an important component in the pharmacovigilance system, efficiently contributing since its inception to the vision of the Ministry of Ayush. So thank you so much for organizing this orientation program. And thank you so much for this wonderful opportunity. Thank you so much. Namaste.
Any queries? Namaste, sir. One query I had was now drug-induced liver injury and then Ayurvedic medicines. They are being much hyped, and the unfortunate part is that articles are being published in high impact factor journals and by very reputed allopathic practitioners. That is immediately, taken into consideration by the public or the community, both allopathic or even scientists. So, can anything, when we try to write a counter article based on this, telling that there are lots of loopholes in the article or the review, the problem is that it is a long process, and mostly at the end of this, the article gets rejected. So, can the authoritative pharmacovigilance unit also consider these case reports that target, like we have articles saying ashwagandha is a liver toxin, guduchi is a liver toxin, ashtavarga is a liver toxin, but we know that it is being used successfully in practice? Or is it that the pharmacovigilance can only do the necessary effects or take steps if a report is being filed? Or such issues can also be taken into consideration, sir?
Yeah, I mean, this is a very relevant question. So we do agree. Well, okay, so what you were mentioning that, but the thing is, again, I will say that this is. I don't want to say that. Okay, so somebody is trying to. Okay, if they are reporting it, so I'm not on behalf of them, or I'm not saying that we are not doing anything. So the thing is, we should come out with safety profiles. It becomes the responsibility of each and everyone's responsibility. So whatever we are looking for, whatever we are doing the research, it should be published on a credible platforms. Okay, so I'm not saying that once if somebody is saying that guduchi is toxic, so then we're trying to say that no, guduchi is not toxic. Before that, whatever the PG thesis, whatever the PhD thesis, whatever the research that we are doing, why we are not coming up with a why we are not coming up with a credible publications on a credible platforms, good platforms. So my purpose of saying this is we are doing research, but the publications are not seen on a credible platforms. So until and unless if publication is not there, you know that, okay, so publication and research both are the two facets of a coin. If the second facet is not there, you suppose, so it becomes there is no validity for that. So that's why if somebody raises some query on Guduchi, somebody says that ashwagandha is toxic. So then, okay, so we try to say that no, ashwagandha is there and it is coming since thousands of years and it is there in our practice. So that become a routine answer for that, but it won't. Okay, so simply saying that yes, okay, so we are practicing is not enough. For that, okay, so we need to have that systematic and stringent regulations are to be followed before, okay, so putting the evidences on a standard platform. Okay, so of course, okay, so I'm not saying that okay, so somebody is wrong when he is saying, when she is saying, when the researcher from the counterpart is saying that it is toxic. So they may be looking through their eyes. Okay, so they are looking through the conventional eyes. So they are looking through the eyes of chemistry or molecular biology. Okay, so they may be saying that okay, so this is. But when we are using drug as a whole, so if at all it is giving us some benefit, and if at all it is giving some positive outcomes, if at all it is not creating any sort of toxicity, so then it has to be, definitely it has to be published on a standard platform. I do agree that okay, so many a times, okay, so the communications they may be rejecting, it is rejecting because of okay, so we may not be standing in there, okay, so levels of whatever the regulations that are being required at that specific level. But at least okay, so we can publish the technical documents so at multiple levels. So it may not be in the same journal, but okay, so there are many other journals so which are scientific, which are standard enough, okay, so that are to be considered. Okay, publications are to be considered. This is one point. And second thing is, you mentioned that whether pharmacovigilance systems, okay, so they are taking care of okay, so such kind of to address okay, so such kind of issues or not. Okay, we tried. Okay, so for that Guduchi, whichever is referred, whichever was published in hepatic communications, I feel it was in that journal. Okay, so there was a communication. There was a letter to editor. Okay, so from our side, from the ministry side, there was a communication. But the thing is, until and unless if we don't have a standard publications, it becomes very difficult to defend the concerns that are being raised. That too, okay, so in this decade, if at all you are looking, suppose frequently they are creeping into the society. Otherwise, one or the second day we are facing such kind of concerns that are being raised on one or the other part of the traditional systems of medicines. So uh, I feel okay. So instead of becoming okay, panicky to look such kind of concerns. So we should be strong enough to uh, say that okay, so our traditional practices definitely okay, so they may create some sort of positive note, positive environment. Okay, so in the healthcare system, so such kind of systems are supposed to be documented, well documented, and such kind of documents are supposed to be vetted and they are supposed to be published at standard platforms. Okay, so until and unless there is no publication, so it becomes very difficult to convince the conventional community. So this is what I would like to put forward.
We extend our heartfelt gratitude to Dr. Galib for his enlightening session on reporting of toxicity due to Ayurveda medication. His insights have been invaluable in enhancing our understanding of this crucial aspect of healthcare. Thank you, Galib sir, for sharing your insights with us.